Lisa says she's concerned about her severe splitting toenail, so we invited Beverly Hills podiatrist Dr. Sadrieh to join us. Welcome to you both.
Thank you.
Thank you.
I don't know that we've talked about split toenails before, but I'm going to ask you, how long have you had this problem?
Yeah, it was about 10 years ago. I had a pretty bad ingrown toenail, and they had to surgically go in and remove it. And in doing so, they cut away some of my toenail, and it's been this way for 10 years. It's been ugly and split. It's never grown back normally. And I always have to cover it with 4 layers of nail polish.
Now, do you have any pain with this?
No.
Nope, no pain.
No pain.
Dr. Sadrieh, what are the common causes of these quote-unquote split toenails?
Yeah, this can happen for a variety of other reasons besides what happened here with Lisa. Nutrition issues usually cause brittle, thin nails. And so the nails will split, which is very embarrassing because you don't have a normal nail. You can't put polish on it. It gets irregular. For men, it's uncomfortable because that split nail can then get infected with fungus. There's this holy barrier between the nail and the nail bed. And once that sacred barrier is separated, fungal organisms can get inside and give you a fungal infection. So it's not just unsightly, it's also dangerous for infection purposes.
So once you develop a split nail, you may not be able to get it back to normal without a procedure.
Exactly. And even that becomes debatable because if the trauma is beneath the nail bed is torn, that might be permanent. For her case, it's not, fortunately. This is a result of an ingrown nail procedure that was performed with an old-fashioned technique with liquid acid. And they put it in there and it kind of spreads irregularly and causes trauma to the nail. So as you can see on the nail, the margin on the outside of the nail is all irregular. We call that dystrophic nail. It's not growing normally. So what we're going to do is actually remove the nail and then nurse it as it grows back, getting a nice adhered nail bed barrier. And this component here, where you see all that bruising, is because her nail's not sitting correctly, so it gets constantly bruised, like a subungual hematoma, blood formation.
And a really good takeaway for anyone watching at home is, even though your nail is not living tissue, that nail bed is absolutely essential for pristine nail growth. Meaning, if you damage that nail bed, then you are setting yourself up for potentially some long-term complications. That's why you're gonna have to be so meticulous after this procedure as the nail grows back out.
Well said. That's why good follow-up with your local podiatrist. You know, it's not just a one-time thing. You want to follow through the process. What we're going to be doing with Lisa is seeing her regularly for about a year until the nail grows back. It takes 1 year for a toenail to grow back. Fingernails for about six months.
You ready for this?
I'm ready. Let's do it.
All right,
Let's
Dr.
rock and
Sadrieh,
roll.
take it away.
All right, so we're going to do a little procedure here. What we're going to do is we're going to remove the nail from the nail bed carefully without causing too much trouble. Now, first, let's check that you're nice and numb.
So everyone, take a deep breath.
Bad.
Lisa will not feel a thing. She has had a digital block, which
Yes.
means...
No sensation, Lisa? This doesn't hurt?
No sensation.
She doesn't feel a thing. The injections are relatively painless. We use a cold spray. This is something that your doctor can do in their office, very simple. First, we're going to push back the nail barrier here. And this is very important because we want to make sure that our nail comes off simply and easily. There's a little bit of blood, so what we'll do now to stop the bleeding is, if you could, Dr. Travis, please press that inflate button on our tourniquet to see that this will stop. Thank you, sir. All right. So that's a nice little tight cuff around there. There we go.
Doing okay?
Yeah.
Now we're going to gently get underneath the nail, nice and slow. This does not hurt.
Okay, everyone, again, deep breaths. And Dr. Sadrieh is very carefully and meticulously separating the nail from the nail bed because he does not
Correct.
want to do further damage to that nail bed.
No, this instrument is staying directly underneath the nail. I'm actually staying away from the nail bed. And so now that we have this separated nice and clean, we're actually going to slowly lift the nail off. Now, part of what happens with these procedures and these old-fashioned ingrown nail procedures is the acid creates kind of a scarring process on the nail bed, which we're going to clean up once we have the nail removed. So I'm going to put this instrument here and slowly lift the nail off. Everyone's like,
No.
and that is our nail.
But you all see how meticulously that was done.